right. Okay. Hello, welcome. Good evening. Hello, hello. I see a volunteer on here. Hi. Good to see you. Thanks for joining us. Hi, welcome, welcome. We're going to get started at 7 o'clock on the dot. Thank you so much for coming tonight. It's a beautiful night out, so we appreciate you taking your time and being with us. It's very exciting. Let me get this up. All right. Well, good evening, everyone, and welcome to Substance Use as a Self-Coping Mechanism, Understanding the Relationship Between Mental Health and Substance Use, brought to you by NAMI, Cook County, North Suburban, Erin Tegge, the Prevention Director at Peer Services, and the Des Plaines Public Library. Peer Services reduces the harm of substance use, addiction, and stigma by engaging youth and young adults with innovative prevention programming and by supporting people on their path to recovery through holistic, evidence-based treatment. Peer Services provides affirming services to all who are in need, regardless of their ability to pay. More information can be found at www.peerservices.org. Before we begin, I would like to take a second to thank the Des Plaines Public Library for sponsoring this event. The Des Plaines Public Library's mission is to be a catalyst, advocate, and place to advance the vision and ideals of the Des Plaines community. The Des Plaines Public Library is at 1501 Ellenwood Street for those interested in stopping by. Thank you so much for your support and for making this event happen. We truly appreciate your partnership. I am Bree Hoekstra, the Program Director at NAMI, Cook County, North Suburban. NAMI, or the National Alliance on Mental Illness, is the nation's largest grassroots mental health organization, providing public awareness, no-cost support, and education programs online and in person so that people and families affected by mental health conditions can live better lives. We are a lifeline to individuals and families who do not know what to expect in their difficult life journey. We offer classes, support groups, and do a lot of local advocacies for mental health. Our programs are free and open to those in our community service areas, but we do not turn anyone away who is in need. We are so pleased to have you all here tonight. This year, each month, mental health professionals will dig deep into a variety of mental health conditions to provide further education and raise awareness to fight and end the stigma that surrounds mental health. For our topic tonight, Erin Tegge will further educate us on substance use as a self-coping mechanism, specifically to learn how to identify the current trends and prevalence in both teen and adult substance misuse, to understand the different criteria for a substance use disorder, including risk factors, how to identify the 3 ways in which substance use can impact mental health, and/or how mental health can impact substance use. According to SAMHSA, or Substance Use and Mental Health Services, mental health problems can sometimes lead to alcohol and drug use, as some people with a mental health problem may use these substances as a form of self-medication. Additionally, SAMHSA reported that more than 1 in 4 adults living with a serious mental health problem also has a substance use problem. Erin will spend time discussing the relationship between mental health challenges and substance use among teens and adults. She will dive into various substance use trends, motivations for use and non-use, and how mental health adds complexity in understanding, preventing, and treating substance use disorders. Our Q&A will be held at the end of the presentation. However, if you would like to type your questions in the Q&A box during our conversation, please do. Our guest speaker tonight, Erin Tegge, is the Prevention Director at Peer Services. Erin and the prevention team work closely with the Evanston, New Trier Township, and Glenview, Northbrook communities. She oversees implementation of best practices in prevention education and data collection and analysis of local trends in youth mental health and substance use. An expert in youth prevention, Erin regularly provides consultation and delivers presentations for youth, families, school staff, and community stakeholders. Erin joined Peer in 2014 and has over 15 years of experience in substance use prevention and social work. She earned a bachelor's degree in psychology from the University of Illinois at Urbana-Champaign and a master's in social service administration or social work from the University of Chicago. We are so pleased to have her here tonight to further educate us on this ever important topic. I am honored to welcome our guest speaker, Erin Tegge.
Thank you so much for that wonderful introduction. I feel like the first couple of my slides are taken care of. So we will jump right into the content. I will get the information up on the screen and we will get to it. Yeah, again, I just really appreciate everything from NAMI, being invited from them, Displays Library, and all of you who are joining us today. A little bit more about peer services and just some of the different services that we do provide. We do have our prevention department, which I run. Then we do also have adolescent early intervention practices in which we work really closely with a lot of the high schools in our communities. And we have substance use disorder counseling, all outpatient, so it can be individual, it can be group. We do some DUI risk education. We have an expressive arts therapy department and program, which is wonderful. If anyone actually is near Glenview Public Library this month, go check out one of their art shows. We also have a medication-assisted recovery program specifically for adults who struggle with opioid use disorder. We do a number of different community-based treatments with community partners such as St. Francis Hospital, the Living Room, other community places like that. And we also do a lot of opioid overdose prevention. So a lot going on in our locations, and we are both in Evanston and Skokie, but all over the place for sure. So I think we covered the agenda and the learning objectives, so we're going to jump right into things. So I wanted to pose a couple questions, and feel free to either think about these questions internally, or if you want to use the chat function, feel free to, throw some thoughts into the chat. But just to get our brains around this topic, substance use, mental health, first question that I have for you to think about or share in the chat is, what could lead someone to experience a mental health challenge? Take a minute, think about what that might be, why someone might experience a mental health challenge. Like I said, if you're willing to throw some thoughts in the chat, feel free. If not, definitely just in your head is fine. Yes, trauma, definitely. Trauma is absolutely one of the most common things when someone's struggling with mental health. Yeah, loss, absolutely, that grief, any sort of loss, whether it's the loss of a person, a loss of a job, a loss of a relationship, loss, absolutely, and substance use. Thank you. Any other thoughts on this one? Yeah, lots and lots of reasons out there. Stress, changes, transitions, you name it. It can lead to someone experiencing mental health. Yeah, genetics, environment, absolutely. So then the second question, thinking about the substance use component, what do you think could lead someone to experiencing substance use challenges, or just lead them to use in general? Give you a minute or two to think about that. All of the above. Yes. It's almost like I planned that. Peer pressure, definitely. Some of those social pressures, not just for teens, absolutely adults too. Yep. Friendships. Yeah, I think the social component of substance use is super interesting. Yep. Mental health, loss, all the things that lead to mental health challenges. Yeah. So obviously, you all can probably see why I pose those two questions. The answers to both can be exactly the same, relate to one another, overlap, etc. So that's definitely what I hope to show as we have this conversation today, as I share lots of information with you all. So why is this important? So I need to preface, I'm a bit of a data nerd, so I kind of like data a lot. So I am going to start with a fair amount of data, just to give an idea of what is going on in our community across our nation. So I have both adolescent and adult statistics to share. So we know 1 in 5 adolescents and 1 in 5 adults will experience a mental health or substance use challenge. So that is a lot. 1 in 5, 20% definitely impacts a lot of folks. We also know 30 to 45% of teens that are struggling with a mental health disorder also have a substance use disorder. So it's a pretty high percentage of teens who are struggling with mental health are then also struggling with substance use. Similarly, but not quite as high for adults, 26% of adults with some sort of psychiatric disorder also have that co-occurring substance use disorder. And you'll hear me say the term co-occurring a lot tonight. That just simply means mental health challenges and substance use happening at the same time. The next set of statistics. So about 90% of adults that have a substance use disorder began in their teen years. That statistic is probably why I'm in prevention and why I think prevention of anything, substance use, mental health, is so important, because so much of it stems in those adolescent years. And we'll get into a little bit as to why that is. Similarly, with mental illness and mental health challenges, 50% of them begin by age 14 and 75% begin by age of 24. Also why prevention in these conversations are so important. So then kind of looking at the flip side of substance use disorders and corresponding mental health, we know about 37% of adults that have a substance use disorder also have a mental health disorder. And 65% of teens, so much higher, that have a substance use disorder also have that mental health disorder. So hopefully these statistics are helpful in showing just how significant both of these things are. In my field, yes, my focus is substance use, but you really can't talk about substance use without talking about mental health and vice versa. And we're trying to make that vice versa, the mental health, talking about substance use, a lot more common, but they very much go hand in hand. I do have some kind of national broad data to share as well. So the next few slides are from SAMHSA, the Substance Abuse and Mental Health Services Administration. They do a national survey on drug use and health, and this is their most recent data that we have just to get that really big picture of what is going on across our nation as it relates to substance use and health, specifically mental health. So the first couple of slides I have here are specifically focused on our adolescents, so our 12 to 17-year-olds. And what I really want you to focus on in this particular slide is this purple. So what this graph is showing is this red is how many adolescents had a major depressive episode. So that major depressive episode is just one component of mental health, but this is the data that they have, so that's what we're using. And then the blue is an adolescent with a substance use disorder, but this purple in the middle is where those overlap and where those adolescents have both. So you can definitely see that over 850,000 adolescents across our country were struggling with both a major depressive episode and substance use. The next slide really shows how having a major depressive episode among teens impacts that substance use. So this is looking at teens who have experienced a major depressive episode versus those that did not, and looking at either past year use or past month use. So the first three on here, illicit drugs, marijuana, and opioid, are focusing on past year use. But then we have binge drinking of alcohol and tobacco products, including vaping, are those bottom two. And that blue line are those teens who have experienced that major depressive episode. So you can see that their usage rates are significantly higher than those that have not experienced that mental health challenge or that major depressive episode. So definitely teens who are struggling with mental health have those higher usage rates, as we can see from this particular data set. Then kind of switching over to our adult population, very similar to our teens. So there's a lot more going on this slide, but I'll break it down a little bit. So just like when we were looking at our teens, we were just looking at that major depressive order. What this slide in looking at adults is looking at any mental illness and a serious mental illness. So any mental illness, we're looking at that yellow, green, and blue set of circles on the left, and then a serious mental illness we're seeing with that red, purple, and blue on the right. And again, similarly to what we were looking at with our teens, we're looking at where those circles overlap. So on the left, that green set part of the circle, over 20 million adults had a substance use disorder and any sort of mental health disorder. Over 20 million adults had both. That is a pretty significant portion. Similarly, we can see on the right, when we're looking at those serious mental illness, over 6.8 million adults had both that substance use disorder and that serious mental illness. So this is absolutely impacting lots and lots of people, whether we know it or not. And so I think this data is so important to help normalize these conversations, to really destigmatize what is going on regarding mental health and substance use. Similarly, with our teens, the chart that we shared for our adolescents, really looking at those who are struggling with any sort of mental illness, especially a serious mental illness, have pretty significantly higher rates of substance use. And again, we're looking at that past year use for those illicit drugs, marijuana and opioids, and then past month, alcohol and tobacco. So again, just really reiterating, and I love when data shows, points that I'm trying to prove, just how important this conversation is, because it is very evident that absolutely those who are struggling with mental health have higher substance use rates. And so kind of what does that mean? Well, that's kind of what we're here talking about today. So I think it's really important to kind of take a step backwards and really look at and have a basic understanding of substance use before we get into how it really relates to mental health. Because a lot of how substances impact our brains and our body really then impact our overall mental health. So we are going to cover just some basic substance use information to make sure that we're kind of all on the same page. So kind of like our first couple questions showed, there are definitely common risk factors for substance use and mental health. We have our genetic components. Just like mental health can be genetic, so can substance use. The genetic aspect of substance use accounts for about 50% of someone having a substance use disorder. So if you have a parent, if you have a sibling in your family that has a substance use disorder, then you are that much more likely to have a substance use disorder as well. That genetic component is so important to know and understand. And we always encourage families to talk about it. Because, if you have a kid and there is a history of substance use in your family, they need to know because it absolutely can impact them. Definitely our brains and the different areas of the brain that mental health challenges happen, that substances impact, overlap a lot. Then we have our environmental influences, stress, trauma. We covered all of these. Well done. You all had the answers at the beginning. But all of these are those common risk factors for both substance use and mental health. So I do have, it's like a minute 45 video that does a really great job of going through the brain science of addiction. This particular video comes from Addiction Policy Forum, which does have a lot of really great resources, especially resources in lots of languages, which is super helpful. So they have a lot of really good stuff. So this is one of their video clips that gives a really good overview of how addiction, how substance use disorders happen, and kind of those changes in the brain. So fingers crossed, the video works.
There are two main parts of the brain affected by drug use: the limbic system and the cortex. The limbic system, located deep within the brain, is responsible for our basic survival instincts. So, when you do essential things to stay alive, like eat, drink, find shelter, build relationships, or care for your young, your brain reinforces behaviors that cause the release of dopamine from this region. That reward for surviving is also transmitted to the amygdala and hippocampus, which records a memory of that feeling so we seek it again. This is our survival hardwiring. Addiction also affects this area up here. That's the prefrontal cortex, which is what separates us from other animals. And this is where decision-making and impulse control live. When drugs or alcohol are used, they activate the very same dopamine process in the survival center. And when use is repeated, that substance can hijack that part of the brain. This hijacker changes the brain and weakens the system to make it believe that the primary need for survival is the drug. In hijacking the brain, it can usurp those primary motivations: food, water, shelter, relationships, and protecting our young. And the hijacker needs more and more of the substance to activate the same level of reward or feeling of pleasure, causing the brain tissue to become increasingly damaged with continued drug use.
All right, so really quick video just to understand kind of those basics of how addiction happens. One of the things that I find so cool about the work that I do in prevention, especially working with our elementary and middle school kids, is all the neuroscience that we get to do. And I think it shows a lot about the substance use field in particular, that we really have moved away from kind of that moral behavioral type aspect to really focusing on how addiction absolutely is a brain disease and how our brains actually change when substances are in the body, and especially when it gets to substance use disorders and addiction. So when we're thinking about substance use, there are a lot of legal substances out there in the world. Adults engage in use, and there are plenty of people out there that never have any issues. They can control it, doesn't impact their lives, etc. So how do we know, and what are some of those things that we look for to really identify, like, okay, is this becoming a problem? Is this really impacting my life? Or is this impacting my spouse or my kid or whoever? So we look at a number of different things as we're trying to determine, like, okay, is this use problematic? So we look at a number of different categories. We have 4 that we're going to go through. So the first is looking at shifts in mood and personality. And, not surprisingly, the first one listed on here is, getting at some mental health related aspects, thinking about depression. Are the people, are they withdrawn? Are they acting like they're depressed? Are they less motivated? Are they being secretive? Are they unable to focus? Are they, hyperactive or really elated? It can kind of go all across the board. Then we look at some behavioral changes. Are their relationships changing? Are they absent from work or school or activities? Are they being super secretive about their possessions, their phone, making endless excuses? Chewing gum, having mints all the time to try and cover up smells, having cash flow problems, things of that nature. Just really trying to look at changes in behavior. Then we have looking at hygiene and appearance. Are they, having poor hygiene? Are their eyes consistently, red or bloodshot? Do they have burn marks? Do they have track marks? Are there certain things that are, changing about their overall appearance? And then we also look at physical health. Are they frequently getting sick? A lot of the substances that are out there actually decrease the effectiveness of our immune systems. And so those who are regularly using substances get sick more. So is there that? Is there changes in their energy level? Are, they more tired, more lethargic? Is their speech impacted? Again, some of these other physical health sores and spots. Weight gain, weight loss can be a really good sign about substance use and things of that nature. So these are kind of all the things that we're trying to assess and trying to look for and determining, like, okay, is this person struggling with substance use? I think a lot of these, especially on the prior slide, those could also be signs of a mental health condition or a mental health challenge. And so it can be really tricky to try and figure out, okay, is someone acting withdrawn or tired or, isolating themselves because they're struggling with depression? Or is it because they're struggling with substance use? It can be really, really tricky to try and figure out, what that root cause is, what's actually going on. So then when we look at, so let's say you have a concern about a person, you're concerned about their substance use. This particular slide shows kind of the assessment areas in which us as clinicians look at when trying to diagnose if someone has a substance use disorder. According to the DSM-5, the Diagnostic Statistical Manual, which has all the diagnoses for mental health and substance use. So we look at these 4 areas. We look at impaired control, social problems, risky use, and physical dependence. So if we look at that impaired control column, are they using more of a substance or more often than intended? And that goes back, to what the video showed, because our brain, because of that dopamine that's getting released from the substances, when we build up a tolerance for that substance, we need more and more and more of that substance or use it more frequently to get that same effect. Also with this impaired control, is the person wanting to cut down or stop, but they can't? Is that because of those cravings? Is it because if they stop and start to experience withdrawal symptoms, which we'll talk about in a little bit, but there's lots of reasons why someone might want to, know they need to, but then they can't. Then we look at those social problems, those social aspects. Are they neglecting responsibilities, relationships? Maybe that's school, work, volunteering, whatever is on their plate. Are they giving up activities that they used to care about? Maybe they loved baseball and would go to Cubs games and, stop doing that, or whatever the case may be. Inability to complete some of those tasks at home, school, work, etc. Then we start looking at that risky use. Are they using in risky situations? Are they kind of maybe increasing the risk of the substances that they're using? For example, if someone started using prescription pain medications or a prescription opioid, and then all of a sudden they switch over to heroin or fentanyl, that it would definitely be an indication of increasing the risk of use, of risky use. Also continued use despite known problems, whether that's physical problems, problems at home, social life, all those things. And then we have that physical dependence, which is similar to that impaired control situation. They've built up that tolerance, and then they experience those withdrawal symptoms when they do not have that substance in their body. So when we do look at someone having a substance use disorder, it is a continuum. There are different levels of a substance use disorder. So if someone can identify 2 or 3 symptoms out of any of these categories, it's what we call a mild substance use disorder. If they have 4 to 5 symptoms, that's a moderate substance use disorder. And then if it's 6 or more symptoms, then that is what we consider a severe substance use disorder. And those classifications or categories very much then determines kind of course of treatment. But definitely as we think about the mental health components and the substance use components, definitely if someone is experiencing these along with those mental health challenges or has a mental health diagnosis, this would be a really good indication that they might have that co-occurring disorder and need help and support and treatment for both. So getting a little bit into the nitty gritty on the different substances that we have. So I have a number of ones that we're going to quickly cover. So alcohol is the most commonly used substance, period. Teens, adults, that's just what it is. We can talk all day long about why, but that is a webinar for another time. But the important things to know about alcohol, the most important thing is that it is a depressant. So it slows things down. It absolutely does release that dopamine in your brain, like the video talked about, which makes us feel good, but it also has those calming effects, can make people feel more relaxed. And so as we, think about why someone might use, if they are struggling with substance use, maybe they're struggling with anxiety. And so if they drink alcohol, it can help try to lessen some of those symptoms of anxiety. They might feel more calm. And so that could be a reason why someone might use alcohol. But we definitely know there's a number of different effects. With alcohol, can affect our memory, our attention, our concentration, our balance, our speech, our judgment, all the things, increased risk of injury, increased risk of aggression, lots of different things. Some of the long-term effects, especially if we're thinking about our kiddos, our teens, drinking before the age of 15 increases the risk of a substance use disorder later in life. It absolutely can alter brain development for our adolescents and their still growing brains. And it can lead to some pretty significant longer term mood, sleep disturbances, and also increases the risk of depression and anxiety. Then switching over to cannabis. So really quickly about cannabis, because cannabis has changed significantly over the past few decades. Cannabis, marijuana, weed, pot, cannabis is the technical term of the plant, which contains lots and lots of chemicals. The main one that we focus on in the field that you kind of hear about is that THC, that tetrahydrocannabinol. That is the psychoactive chemical. That is the chemical that gets you high. That is the addictive component of the cannabis plant. And what we're seeing, specifically with the cannabis plant, very much how it relates to mental health, is the increased potency. And when I say potency, I simply mean the strength of the drug. The average THC in cannabis has grown significantly. So back in like the 80s and before, 90s and before, the average THC levels were about 3 to 5%. So relatively low. However, today, the average just in the plant levels of THC are between 12 and 15%. And then when we look at some very specific products like concentrates, edibles, things like that, it can range from 40 to 95% THC. So the strength of THC has gotten significantly higher, which is absolutely impacting mental health of folks who are using. So some of the short-term effects of cannabis, very similar to alcohol, actually. It impairs thinking and memory and learning and attention and balance and coordination, reaction time, judgment, decision-making, perception, lots and lots of ways, lots of areas of the brain that cannabis impacts. And because of the high potency levels, we see a very big increased risk of anxiety, panic attacks, hallucinations, delusions. THC actually acts as a stimulant on the body, even though when people think about cannabis, they think it makes people kind of chill and relaxed and that it should be a depressant. But actually what it is a stimulant, and it makes the heartbeat a lot faster and kind of increases some of those processes, which actually puts people at risk of a heart attack. And definitely when it is smoked or vaped, there's a lot of potential harms to the lungs as well. Some of the long-term effects, cannabis, that THC is absolutely addictive. So we do know that about 1 in 5 teens who use cannabis will develop a cannabis use disorder. It absolutely alters brain development, especially in our teens, again, with their underdeveloped brains. It can decrease IQ over kind of regular prolonged use, cognitive impairments, especially the hippocampus, which is responsible for our memories. And then there's a couple different syndromes. Amotivational syndrome, which really decreases motivation, and then cannabis hypermesis syndrome. And that is one that we see, which actually is very similar and looks like someone has the flu. And so there's uncontrollable vomiting, nausea, things of that, which absolutely requires medical attention. So one of the other interesting things about substances is while someone is using, we may not see some of the mental health impacts necessarily, but we might start to see some when they stop using that substance. So when withdrawal symptoms can happen, we might see that. So specifically with cannabis, the interesting thing about cannabis is someone might not experience withdrawal symptoms until about a week after they stop. And that is because of how THC is stored in our bodies. It is stored in our fat cells. And so it takes our body a lot longer to break down that THC than any other substance. So withdrawal symptoms will be experienced a lot later, about a week after one stops. So, for example, you can see here just some of the different things that someone might experience from a THC withdrawal. Definitely things that can align with a number of different mental health challenges. Irritability, extreme nervousness, that anxiety, impact on sleep, increase or changes in appetite, being restless, potential onset of depression, and then some sort of physical symptom. Some of these symptoms listed on the bottom could be indicative of that cannabis hyperemesis syndrome, but definitely abdominal pain, fevers, headaches, etc. So we might not see some of these until after a week after the person stops using. Then getting into tobacco, e-cigarettes and nicotine, vaping. So that nicotine, that is a stimulant. And so that absolutely increases things in our body, makes things feel like they're moving a lot faster, increases our heart rate, things like that. And one of the interesting things about nicotine that's around today, especially with our e-cigarettes and vaping devices, and also those oral nicotine pouches, is the type of nicotine that is used. So if you have a cigarette, that's what we call freebase nicotine. So that's the kind of more traditional tobacco leaves into the cigarette. I guess it's more natural. I hate using that word, but it is a more natural process of using nicotine, is in those more traditional cigarettes, cigars, pipes, etc. But with our vaping devices, our e-cigarettes and oral nicotine pouches, if you've heard of Zyn lately, these contain a nicotine salt. So it is a whole process that the nicotine goes through, and kind of changes the way that our body responds to the nicotine. So when nicotine salts are used, our body actually absorbs more nicotine at a faster rate than with traditional products. So definitely with our teens, we talk about this a lot to help them understand the risks of nicotine use. But what we see when someone is using nicotine, it absolutely changes the way our brain works, especially around the areas of the brain that are important for impulse control and attention and learning. It increases that heart rate, like I mentioned, because it is that stimulant. We do know that nicotine is highly, highly, highly addictive. About 90% of adult smokers started before the age of 18. And that just really shows how addictive that nicotine is. And definitely some of the long-term effects that we see, lung disease, lung cancer, and cardiovascular disease because of what nicotine does to our heart. So similarly with cannabis, sometimes we see some of these mental health things pop up when someone's experiencing withdrawal. Withdrawal from nicotine happens very fast, as opposed to cannabis that can take a week. Withdrawal from nicotine can happen in a very, very short period of time. I mean, it can be a couple hours. So much, much different in that regards. However, here we see definitely potential increase of feeling down or sad, which can lead to depression or be irritable or grouchy, hard time concentrating or thinking, restless, jumpy, potential increase in anxiety, absolutely impacting the heart, appetite, things like that. Then we have our prescription drugs. So there's a number of different prescription drugs, and these are just some of the examples of some of the effects of misuse. So if someone is taking a prescription in a way other than prescribed, taking more frequent, taking someone else's prescription medication that's not theirs. And these are just some examples of what effects of misuse of a prescription drug can include. And definitely as we look at those stimulants, anxiety is, one of the number one things that we often see when someone is misusing a stimulant. So that would be like an Adderall or Ritalin, something like that. And again, when someone's misusing, not if they're taking it as prescribed, unless these potentially could be side effects as well. So kind of going back to that, why a person might use, like we've already touched upon, and what our focus today really is this, fourth one down, this escape into self-cope. I talk to teens all the time, and so often a reason for use other than some of those social pressures to fit in, et cetera, is that escape and to self-medicate. You know, as we've seen in our data, there's a lot of mental health struggles going on. And so someone may turn to a substance to do that. You know, when someone uses a substance, they initially feel good. They may initially be able to escape from whatever it is that they're feeling. They may feel more relaxed. Their, you know, anxious thoughts might dampen when they are, you know, drinking alcohol or using some substance. So there may be that initial feeling that they're trying to achieve. But the thing with substances is that's very, very short-lived. As soon as the substance is out of their body, in the short term, then, you know, after a few hours, a few days, whatever, depends on the substance that they're using, they're going to go back to feeling and having those struggles with mental health as well. And so it is definitely not a solution. So now we're kind of going to flip the other way. And we're going to look at some common mental health diagnoses and then look at more specifically about how certain substances may impact those particular mental health challenges. So first, I've already talked about anxiety a number of times, but when we're thinking about anxiety, it is normal for any of us, adolescents or adults, to experience some levels of anxiety, some levels of stress. But really, when it begins to interfere with our ability to handle life, handle everyday things, that's kind of really where that, you know, level of concern is. And so looking at some of these signs of anxiety, trouble sleeping, trouble concentrating, increased fidgeting, decreased concentration, racing minds, increased use of drugs or alcohol. But, you know, it's interesting as I look at this list and think back to, you know, some of the signs of substance use, these overlap a lot. And so again, as, you know, you're either looking at yourself or if you're looking at a loved one, a spouse, kid, grandparent, whoever, as you're, you know, if you're noticing, oh, this person's having trouble sleeping, oh, they're having a decreased concentration or memory, oh, trouble focusing on a task, really trying to figure out like, oh, is this because they're anxious or are they using nicotine? You know, trying to really figure out and determine like what is going on. It's very difficult. It is not easy. There's so much to keep track of. And there are so many similarities. Also, similarly with depression. So, you know, someone who's experiencing depression is having those chronic feelings of worthlessness, losing interest in things that they've previously enjoyed. Also a sign of substance use disorder. Absolutely those who have depression and use substances are at a much higher risk of self-harm and suicidality. And, you know, teens and adults who are experiencing depression are more irritable, restless, negative, signs, you know, other signs of depression, you know, indecisive thinking, difficulty concentrating, changes in eating habits, weight loss, weight gain. Again, similarities with substance use disorders and some of the other substances that we've talked about. Lots of overlap here. Then we also have ADHD. And teens, especially teens who have ADHD, they are at a much higher risk of substance use. A lot of that is because of that impulsivity. We know teens are impulsive just by nature. But those who struggle with ADHD are at a much higher risk of substance use and are more likely to use because of that inability to really control those impulsive behaviors. Self-esteem can often be impacted with ADHD, which can lead to other signs of depression or, you know, that social aspect. I've heard from teens in particular who turn to substances, you know, because they are struggling socially and they want to put on this facade and they are, you know, having a hard time focusing on the needs of their friend. And so they feel like they need to be the life of the party and include alcohol all the time. And so we often see ADHD and that substance use kind of overlap a little bit more so than some of the other mental health diagnoses. And then we have PTSD. So we have mentioned trauma from the very beginning. That trauma is absolutely a risk factor for both mental health and substance use. And there are a lot more statistics just about how those who do struggle with PTSD and substance use. So definitely PTSD is when a person is exposed to actual or threatened death, serious injury, violence, etc., whether that impacted them directly or indirectly. And so we see in the research that those who have a history of trauma are 2 to 4 times more likely to experience substance use disorders than those who have not experienced trauma. And about 25 to 45% of individuals with PTSD meet the criteria for having that substance use disorder. And especially when the trauma happens in childhood, then they are about 74% more likely to develop a substance use disorder than those who don't. And this is really where, in our field, we are looking at those adverse childhood experiences to really try and increase those protective factors and give so much prevention for those kids, because we know that they are at such a higher risk of engaging in substance use. Typically, what we see, people with trauma or PTSD are absolutely using substances to self-medicate, to try and escape, to try and get away from whatever experiences that they've experienced, to really numb kind of those feelings and the pain that they might be having. But substances often make PTSD worse. Based on what we just talked about with alcohol, cannabis, nicotine, etc. Often those substances can lead to increased depression, anxiety, make it more difficult to sleep, concentrate, which can then increase and make that PTSD work. So it can get into this really terrible negative cycle. A few more. Bipolar disorder. So definitely with bipolar disorder, and if we think back to some of the data points that I shared towards the beginning, now we're kind of getting into this slide, and the next slide is really looking at some more of those like serious mental illness aspects. And so we saw that they were definitely at higher risks of substance use. And so with bipolar disorder, about 60% of individuals that have a diagnosis of bipolar also have co-occurring substance use disorder, 60%. So it's really, really, really high. What we see with teens is often they will end up getting a diagnosis of bipolar after they've been treated for substance use disorder, because oftentimes we see with this very specific population, we see that substance use first. And then after, assessment and treatment, we're able to then identify kind of that bipolar disorder. Medication noncompliance is unfortunately a common thing with those struggling with bipolar disorder, which then can increase. It is a consequence of that substance use. And often, and I'll talk about this a little bit too, nicotine and alcohol specifically interacts with those medications a lot more, and decreases the effectiveness of those bipolar medications, which could then make it very, very challenging to treat. Then we have schizophrenia and borderline personality disorder. So about 50% of people in treatment for schizophrenia report drug and or alcohol use. Marijuana often worsens or speeds up the onset of this particular disorder. And a lot of that is because of that increased potency, and those really high potency THC products really do increase that risk of experiencing panic attacks, paranoia, hallucinations, drawing a blank on the word I'm trying to find. That's okay. And so especially if those who are using cannabis and have that kind of predisposition for schizophrenia, we are seeing a lot more of that connection between that substance in particular. Then with our borderline personality disorder or disorders, about 50% of those also meet the criteria for a substance use disorder. Often we see those that have a borderline personality disorder, they are really trying to manage their emotions, typically in very unhealthy ways, which includes that substance use and other risk-taking behaviors. So a little bit more on that medication piece. So medications can be wonderful. Medications can be incredibly helpful in helping someone with a mental health disorder. They can be very, very, very effective in helping someone manage mental health. Absolutely 100%. The really, really, really important thing if someone is taking a psychotropic medication for a mental health disorder, mental health diagnosis, it is so important that if there is substance use, even if it's legal and normal and you're an adult and it's all good, it is so important to tell your psychiatrist, tell your doctor that there is substance use. Again, even if it's moderate, even if it's legal and all that, because a lot of medications that are out there are known to have interactions, especially with alcohol, cannabis, and nicotine. And most often what we see is regular substance use can decrease the effectiveness of those medications. A number of years ago, so at Peer, we have a psychiatrist who I think comes to our office once a week. Doesn't matter. It's great. We have a consulting psychiatrist for our clients, which is amazing and not the norm everywhere. So we're really, really grateful. And I was having a conversation with him just about substance use. This was specifically for a teen case that I was looking at and, medications and use. And, he shared a really quick story about someone that he was working with. The teen had ADHD, I believe, and so was taking medication, the ADHD medication, whether it was Adderall or Ritalin, and like it just wasn't working. And he had been taking it, like this wasn't a new diagnosis or anything, but like all of a sudden it wasn't working. And the psychiatrist was working with the parents, working with the teen, and they're making adjustments to the medication and increasing medication, increasing it a lot more than, the psychiatrist was like, this is just not normal. Because he was trying, he could not get a good therapeutic dose for this kid. Well, it turns out he started vaping, and so he had nicotine in his system, and that nicotine that was in his system was completely messing up with his medications and making them very ineffective, essentially, and requiring a lot more of that medication than he otherwise would. So it is so, so, so important that if anyone is taking medications, and if there is correlating substance use, again, whether that's infrequent, regular, legal, whatever, absolutely talk to your doctor. Please disclose like, hey, yeah, I do have alcohol X number of times a week. Yes, I do use nicotine, because that absolutely can impact the effectiveness of these different psychotropic medications. And this is not an exhaustive list. This is just, some examples. So please, if you are taking any sort of medication, please disclose any substance use to make sure that the right doses are had for you so you can be successful in that treatment. All right, so the last, look at the time, the last aspect that I want to talk about is really figuring out that differential diagnosis, really trying to figure out, like, is this mental health, is this substance use, and then looking at some of those treatment options that are out there for this. So when we're thinking about and looking at co-occurring disorders, when we're looking at that mental health and substance use happening at the same time, it can be incredibly difficult to figure out what's going on. The chicken, the egg, what's happening. It can be really, really challenging. And so it is super important, let's say you are getting treatment for a mental health related issue, maybe for depression, or, you're working with someone with that. It is so important, and you have any suspicion that there's substance use, it is so important to work with a mental health professional that also specializes in substance use. There are tons and tons and tons of great mental health professionals out there, but if they're not trained specifically in substance use, they very well could miss some of those things. It is not uncommon for someone to be in treatment, for their mental health professional not to bring up substances, not to ask about it. And then they're all of a sudden struggling with a substance use disorder as well as their, mental health challenges. And so if there's any indication or any suspicion or anything that there is substance use, it's so important to find a person that can do both, to really be able to address both aspects. And typically, when we look at kind of a comprehensive treatment approach, it includes the proper staffing, like I just talked about, evidence-based therapies, medications, family involvement, connections to community, different stuff, recovery journey. There's lots and lots of different aspects that we really look for that comprehensive approach. Also, when the mental health professional is looking at this differential diagnosis, really trying to figure out, is this mental health or substance use related? They're not just, hopefully, they're not just going to talk to the person who's struggling, but they're talking to loved ones, families, teachers, doctors, healthcare professionals to really try and get the whole picture. Because if we can't get the whole picture, then it can be really, really challenging to try and figure out what the appropriate diagnosis is. So some things that a healthcare provider, mental health professional may ask as they're trying to figure out this substance use mental health piece is, really trying to nail down those symptoms. When did they begin? What makes it better? What makes it worse? If there is, sadness or depression, was it related to a loss or kind of out of nowhere? Yeah, what role do alcohol and drugs play in their life? Are they using illegal substances, legal substances, frequency, et cetera? Looking at that family history, if impulsivity is there, is that personality, or is that more potential manic self-destructive behaviors? Are there major events, stressors, trauma that could be leading to? This is not an all-inclusive list at all, but these are just some things that a mental health provider should absolutely be asking to really figure out, is this substance use or is this mental health? So there are a number of different really effective treatment options. So the chart on the left is looking at just kind of the different levels of treatment. So kind of our individual or group therapy is at the top, which is the least restrictive. Then someone might be referred to intensive outpatient program. So that's 6 to 9 hours a week of programming. Then we have our partial hospitalization programs, which is about 20 hours a week. And then we have our rehab or residential. So definitely as we think back to if someone has a substance use disorder and kind of those levels of severity, those levels of severity very much correspond to these different program options with someone who has a substance use disorder. Some of the really effective things, especially for co-occurring disorders, we have our cognitive behavioral therapy or our trauma-focused, because again, trauma is likely involved, contingency management, dialectical behavior therapy, motivational interviewing, multi-systemic therapy, acceptance and commitment therapy. There are a lot of really, really effective therapies for substance use and mental health disorders, which is amazing that we have all of these options. It's really, really great. Then there's also medication. So just like we have medication for mental health challenges, we also have medication for substance use disorders. And, there's a lot of reasons someone could need medication specifically for the substance use aspect. But, if someone is struggling and their primary is that mental health, but if they are using a substance that is getting in the way, sometimes these medications can be really effective in kind of knocking out that substance use aspect, so that more of the focus can be on those mental health related things. So we do have medication. So medicated assisted recovery is using medications absolutely in combination with behavioral counseling to treat that substance use disorder aspect. So there are a number of FDA approved medications for alcohol, for nicotine, and for opioids. And I'm not going to go into all the nitty gritties of all of them, but the medications for substance use disorders often do a number of different things. Some of the medications will effectively block the effects of the substance that the person's trying to use. Sometimes the medication will make using that substance even worse. And I'm forgetting which medication listed here for alcohol does this, but one of them, if someone's taking that medication and then they drink alcohol, they will get so sick. So it acts as a deterrent for using alcohol. So there's lots of different ways that medications for substances can work. I mean, it's definitely working with your doctor or psychiatrist and figuring out if this is the right course of treatment for you, but definitely whether substance use disorder is the primary or the secondary, medication can be really, really effective, just like with our mental health challenges. All right, so then just lastly, made it by 8 o'clock. Lastly, just some really great resources that are available because it can be really challenging finding that agency, finding that resource that can do both that mental health and that substance use. Us at Peer Services, we can, although your primary diagnosis does have to be substance use. But absolutely, our clinicians are very skilled in the mental health components as well, because mental health absolutely a huge underlying factor in substance use disorders. But then other agencies like Rosecrans or Gateway Foundation, Rogers Behavioral Health Compass, SunCloud, Front Door, Alexian Brothers are all programs that do have specific programming for co-occurring disorders, that dual diagnosis. Because again, like I mentioned, it's so important if there is both that mental health and substance use piece, having trained mental health professionals that can do both is so, so, so important. Other resources that are really great, Partnership to End Addiction actually has a whole, they're a nationwide addiction organization. They have an amazing part of their website specifically for co-occurring disorders that has a ton of resources, ton of information, especially if you are the loved one of someone who is struggling. Lots of really great information. A lot of the material I pulled for this particular presentation came from them. National Institute on Mental Health also has a ton of really great information. Also got a lot of stuff from them for today. There are different recovery groups out there. Smart Recovery is a really great organization for someone who is struggling with substance use in their recovery journey. Obviously not me. And then also if you are, local, Skokie and Evanston, the Living Room is a really wonderful kind of crisis response that is available for people who are struggling with mental health or substance use, with trained professionals both in mental health and substance use. The one in Evanston is not open yet. I believe it's opening October 1st. But we are a part of that, and we will have recovery support specialists on site there if someone comes in with a substance use related thing. But those are some really great options. All right, we made it. And I'm sorry I was ignoring the chat. I'm terrible at multitasking during presentations. So those of you who did put things in the chat,
You are awesome. I mean, like 8 o'clock on the dot. You must practice. That's awesome. Okay, so I actually did close the chat feature. We do have the Q&A feature open for the question portion of this webinar. So if you do have questions, I do see a question already. Please use the Q&A feature. It's just at the bottom of your screen. It should be. And it's like a little chat bubble that has a question mark in it. It should be your Q&A. And there is one question for you. It says, what is the name of the organization that produced the video?
As an easy answer, the organization is Addiction Policy Forum. I can probably answer it. I'll type it out too, so you have the response. But yeah, they're a really great nationwide organization that has tons of resources. They currently, we are actually part of one of their initiatives to reduce stigma. They have a huge focus on reducing stigma surrounding substance use, which is, it's amazing. They have tons of great trainings and resources. And again, they have stuff in like 12 different languages, because I know sometimes that can be a challenge for folks, is getting this information in their native language. And so they have some really wonderful resources there.
Yeah, absolutely. That is a massive challenge. It's great that they provide that. Well, great. Thank you for sharing that. Another question, will you be sharing the information in the slides?
Happy to. I can use, I assume, Bree, you're able to email them out to folks. So yes, I will send a PDF over, and you are absolutely welcome to the slides.
Thank you, Erin. I appreciate that. Yeah. So we are in the high schools for the next couple of days, so maybe give me until Monday. On Monday, I will be sending out an email to all of the people who have registered It will include Erin's slides. Thank you, Erin. And it will also include the video recording of tonight's webinar as well. So please be on the lookout for that early next week. Next question. How can a family member be supportive, especially with a young person who is in denial? I actually had that question too.
That is unfortunately a very common question. Because yeah, I mean, whether it's mental health, whether it's substance use, it's really challenging because you might, bring it up in the like perfect best way possible with the most love and support and, everything, and does not go over well. I mean, and Bree, feel free to, throw in your feedback too. And, I think that one of the most important things, I think, and this obviously depends on the situation too, is ongoing, consistent support, which obviously can be very taxing on you as the family member, but you got to keep showing up. You got to keep showing that support and bringing it up to, in the sense, not of you're doing this, you're doing this, you're doing this, but it's, I've noticed these changes in you. I've seen this is impacting you in X, Y, and Z. So that it's not blaming, it's not shaming, because we obviously don't want to do any of that. And we want to be supportive in figuring out what those next steps are. Figuring out who else in their life are supportive people. Not that you want to do like the, intervention like you see on TV, everyone sitting in a room, but sometimes hearing things from different angles at different times from different people will help that person. Also, I think it is so important for the family members to be getting their own support, whether that's actual therapy or just part of a support group, because it is so challenging to be that family member. And so you yourself need to be taking care of yourself and making sure you're in a good place so that you can help them. And I know that's probably not the best answer, but definitely take care of you so that you can take care of them.
Yeah, absolutely. And that's a lot of the same advice that NAMI gives as well. And so we do have a family to family class that is coming up. Unfortunately, it wouldn't just be for substance use disorder. It's more so for mental health condition, but as you said, Erin, they coexist quite often. So if you do, have a loved one who is experiencing mental health challenges and substance use disorder, please check our website. We have a class coming up in like a week. It's free of charge. It's 9 weeks long. And it will give you all those tips on how to, converse with your loved ones, and you'll get to hear stories and share experiences. So if that's something you would be interested in, check out our website, or you can also send me an email.
Yeah, and that's also where, organizations like Al-Anon are also really, helpful. We have AA for those who are struggling with substance use, but then Al-Anon is for those family members too. Again, talk to other folks who are in similar situations. One of the resources that I had listed, Partnership to End Addiction, they specialize in the family support and have a ton of great resources. They have kind of chat hotlines available. So if there's like super specific things, they have trained professionals specifically focusing on the family members to be able to handle all that. So those are also really great resources too.
Wow, that's amazing. Very awesome they have that. Okay, next question does say, we have a good insurance, but even with that, our co-insurance is outrageous for programs like IOP, etc. Any comments?
Yes. Super unfortunate and very common. And that is why places like us at Peer Services, we really, really, really focus on fundraising and grants and donations so that we are able to not have cost be a barrier, because cost is so often, and like you said, even with good insurance, is often such a barrier because, insurance companies, I mean, thank goodness they're actually covering treatment now, but it's never enough. It's never going to be everything that you need. And so, yeah, unfortunately, lots and lots of people can't get treatment or the type of treatment or level of treatment that they need because of that
Mhm.
money barrier. And I wish I had a solution. Except yeah, finding agencies and organizations that do also get grants. There are a lot of grants from the state and the federal level to help with these types of things because, you know, cost should not be a barrier to treatment. If you're unsure, so at least specifically for substance use, I don't know if there's an equivalent for mental health. So in Illinois, not that I want you to like switch providers or anything, but if you're trying to get an idea of what is out there based on your insurance, the Illinois Helpline has an amazing database of providers throughout the state. You can put in your insurance. You can put in lots and lots of things, and they can help you navigate and find places that might be a better fit cost-wise. But we never want cost to be why you pick somewhere. We want the best treatment for you. That's the best fit for your situation. But yeah, insurance is definitely still catching up to the needs.
Yeah. One day, hopefully.
I know.
Next question. I like this question. It says, what is the difference between supporting and enabling?
Good question. So I see the difference. With support, you are kind of providing and supporting their needs, but still setting boundaries. Just like any relationship, just like anything we do, boundaries are so important. Boundaries help our own mental health and help our own goals and, et cetera. But those boundaries are also there to help that person, that family member with their own decisions, their own next steps, their own independence, all of those things. And so I think the really big difference is support versus enabling is support still has those boundaries in place. But there is still that kind of unconditional love, kindness, goodness, empathy, whatever you want to call it, that's there. But it is still okay to set those boundaries for you and for them. I feel like with enabling, boundaries go out the window. And there kind of aren't those things in place. That's kind of how I see the difference.
That's an awesome perspective. I've never really thought of it that way. I almost want to like write that on a sticky note and put it on my wall. That's awesome. Okay, next one says, I personally have not had good experiences with traditional family friend interventions. What is your opinion on interventions and what is the best thing to do?
It is so individualized. There's no good response. Because and I'm not trying to like avoid the question. Because every person is unique. Every person is at a different point in their journey. And so, yeah, it is quite possible that traditional methods just are not going to work for that person or not going to work for that person right now. And not that you want to like keep trying and keep trying and keep trying all of these different things, but it really is about finding the right fit, whether that is the right therapist, if they're willing to go to therapy, or maybe it's, for in the substance use field, there is kind of a whole thing between kind of your 12-step, AA programs versus your behavioral therapies versus your medication, or combination of all of the above. And so I hope that they would keep trying, like if there is a need and if they're willing to keep trying different things to figure out what works for them, because everything is so individualized. There are some really great kind of other types of therapies out there now. I feel like the expressive arts therapies have become so much more common. Whether that's, art or ceramics or drama or music or, any of that kind of creative aspect. But then, looking at more like the dialectical behavior therapy really looks more at like that mindfulness aspect, awareness type stuff, which can be, really good for some people, other people not so much. I'm one of those not so much people. Not a big fan. Doesn't work for me, but works amazing for other people. I also think now, and I really hate that I'm about to say this, There's actually a lot of really great apps out there now that can help support
Yeah.
people if they're not ready or that kind of traditional model doesn't work for them. Definitely still do your research. Definitely look into things. We never want to cause any adverse harm, but there's a ton of options out there now, which is amazing. So do your research if you're looking at other things.
Yeah, absolutely. Yeah, it's just so interesting because we are just talking about the overlap between substance use disorder and mental health conditions. And even what you just said there's overlap, right? Like, you know, one treatment option for somebody may not be the right fit for another person. So it's just interesting to see, all the similarities. Next question does nicotine really have that big of an impact on the body and medications? I'm not doubting or saying it doesn't. I just never would have thought it would have that kind of an impact. Also, thank you for the knowledge. I would have overlooked it as a substance for myself to work on.
Yeah, nicotine is one of those substances that, I think is one of them, it is a relatively common one. It's been around for ages, I think one of the things with nicotine and why people often look at nicotine differently is because nicotine, well, not aside from secondhand smoking, and secondhand vaping, doesn't necessarily have a great impact. When we think about alcohol, it's, DUIs, same thing with cannabis, and there's lots of kind of other societal impacts. And so nicotine is kind of in this like small little thing, so we don't always talk about it. But I think one of the things, like I shared earlier, that has changed is the type of nicotine, and we're seeing this new type of nicotine have way more impact, just because of how the body processes it. And, because I mean, talking decades and decades and decades ago when people were like, yeah, use nicotine to help with da 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 da, this, that, and the next thing. And so just how we've seen the shift and how it does change our brain, how it does interact with certain medications, can absolutely it can absolutely have that big of an impact, and it is that addictive too, especially with our teens. All I do is talk about nicotine with teenagers now. No.
Totally. Yeah, totally. Thank you so much. Let's see. Okay, next question. How can I set up boundaries during a psychotic episode?
That is a tough one. I'm going to lean into my mental health first aid here. I'm a mental health first aid trainer. So I think when someone is experiencing a psychotic episode, and Bree, feel free to jump into, I think in that moment, we're talking about, they're likely experiencing a crisis in that moment if they're experiencing a psychotic episode. And so, my priority then is always safety and making sure everybody is safe, making sure they're safe, making sure you're safe, and really figuring out and doing things to ensure that safety. If you are able to identify kind of what the trigger is, then we're always going to try and de-escalate and kind of minimize that trigger to really help them through that psychotic episode. But also, if this is someone who does experience psychotic episodes, there likely is kind of that really clear treatment plan, because psychotic episodes can happen for so many different reasons. I mean, if it is a psychotic episode because of cannabis, that is a slightly different situation. Then I would say absolutely get medical attention. If you do know that that psychotic episode is because of cannabis, then that's a medical thing. But definitely if it's not related to substances, ensuring that safety, whatever those boundaries might look like, depends on the situation. Really being consistent and slow in your speech, repeating, really consistent in what you're communicating to them. I think especially in those situations too, if you are not a trusted person, if you potentially are the person that's triggering, making sure that they're still safe, but removing yourself. Again, just really try to figure out safety and ensuring that safety, I think, is the best thing to do.
Absolutely. Well said. I love how you tapped into the mental health first aid. Our teacher is Heather. She's going to be so proud. That's awesome. We do just have a thank you for your presentation, and yes, thank you. That was so informative. I mean, I learned so much just in this short period of time. So thank you very much for taking your time out and teaching us what we need to know
Absolutely.
about this topic. Yeah, you're awesome. Okay, I have some closing announcements. Real quick before we log off, if there are any questions as I'm speaking, please feel free to type them in the chat box, or sorry, the Q&A box. So if you did enjoy tonight's program, you can find more information about upcoming programs and more events at our website, which is www.namiccns.org. Our next program is going to be held on October 23rd from 7 o'clock to 8:30 p.m., where Dr. Joshua Nathan, a psychiatrist from LifeStance Health, will further educate us on ADHD, or attention deficit hyperactivity disorder, in youth and adults. We do have a big event coming up. It is our NAMI Walks. Our annual walk is coming, and please come. Please come. It will be a lot of fun. It's at Gallery Park in Glenview, and it is next to Saturday, on Saturday, September 28th. Obviously, together, we're going to fuel mental health awareness. We're going to raise funds for NAMI's mission and just let people know that they're not alone. I think we have almost 150 people already registered. So if you are interested, please register at our website. It'll just pop up. You'll see it, and we really hope to see you there. Lastly, I did briefly mention this as we were speaking, but we do have our 9-week free class for family members who are caring for their loved ones that do have a mental health condition. It is going to be in Des Plaines at the Frisbee Senior Center. Please register beforehand. You can register on our website. Again, it will be under the programs tab titled Family to Family. Once you log off, you will see a brief survey that will both allow us to better understand how we did tonight, your comfort level with our topic tonight, as well as provide us information we need to raise money to continue providing our programs for free. But we appreciate you. We appreciate you coming. We appreciate your presence, and we look forward to seeing you again, hopefully next month at our next community webinar. Take care of each other and yourselves, and I hope you all have a beautiful night. Bye, everyone. Thank you, Erin. You're the best. I will be in touch with you.
Perfect.
Later. Have a great night. Sleep well.
Bye. Good night, everyone.